Have I converted surgeries into open surgery with a formal incision? Now it's been like 12 or 13 years. Would I convert one? Well, yeah, in case of a bleeding that could not be controlled, I would, but it hasn't happened. Does that mean I'm not an expert at open surgery? Well, I mean, it doesn't mean that you know the bicycle thing. I always tell my patients, if I can't do a surgery laparoscopically, I obviously can't do it open. In fact, at this point, it's easier to perform a surgery laparoscopically than open. So the short answer is no. All right, I'm passionate about this subject, and if you got to know, you got to know. But this is your homework, not mine. How do you find safe surgery in Mexico? Let's start off by saying not all surgeons are created the same, not all centers are created the same, and everybody can brag about what they say is true or they put on their website. Don't believe everything you read, obviously. And don't believe me. So what am I going to do? I'm going to use the 2011 American Society of Metabolic and Bariatric Surgery, American Society, the U.S. Society of Bariatric Surgeons, their statement on health tourism and the traveling patient outside the United States. For starters, they recognize your right to travel outside the United States for healthcare, or Canada for that matter. But then they say, warning. Warning, of course, and I agree with them. Warning. This is a business. What type of business? Run by brokers that don't sell with quality, they sell with price. So they undercut the reputable centers 50% at least. Sometimes so low that a reputable center can't even buy the stuff needed to perform the surgery, and these guys are offering that cut rate price. So the American Society of Metabolic and Bariatric Surgery came out with this 2011 statement, and they looked at some really important stuff. They said, first of all, remember it's a business. Run by brokers, most of the times. Brokers are getting a share of the profit. They send the rest to the lowest bidder. Lowest bidder. You go through a broker, you're probably going to go to the lowest bidder. End up with the lowest bidder, which is usually the surgical team that has to cut corners in order to be able to make a profit out of that small amount of money they were sent. That's how it works. So you go and you price shop, that's what you're going to get. So this statement talks about how to avoid this. Well, first of all, you want to go to a reputable center. And they state two accreditations. You want to go to a Joint Commission, International Joint Commission, which is the accreditation that all the reputable hospitals have in the United States, and they have the international version for centers in Mexico and outside the United States for that category. And what do they look at? They look at the safety of the institution, but they don't look at the surgeon or the practice. So in the statement they talk about that, and then they say, and preferably Surgical Review Corporation, SRC, Centers of Excellence. Why? Well, because it's bariatric specific. That certification actually comes and visits centers, and those that are the designated centers of excellence are the ones that have undergone all the serious, passed all the serious requirements, including for the center, the facility, fully equipped, perfectly equipped and specialized, safe. The practice, their follow-up program, their database, the whole staff, and the surgeons, their abilities, their experience, their knowledge, their continuing education. You can't do all of that. That's why third-party verification companies do that for you. So don't look at a seal and say, oh, I'm somebody that's showing off internationally that they're a whatever reputable. Look for a third-party verification, and if you can't find it, don't go there. There is no reason not to be third-party verified, unless you're telling a lie or you're misstating your experience, right? So that statement published by the American Society of Bariatric and Metabolic Surgery looks at some stuff, and they look at, like I said, the hospital, the facility, the practice and the surgeons. And if you want to really look into some additional stuff, I'll put the link below, the text is here. You want to look at the resources that verify that the surgeon actually is a surgeon, that the physician actually has an MD license, that he's board certified, and that preferably he's a member of some organization in the United States, because that obviously talks about quality in their practice. Fellow of the American College of Surgeons, fellow of the American Society of Bariatric and Metabolic Surgery, at least a regular member, member of the International Federation for Surgery of Obesity, member of their national organization like the Mexican College of Surgeons. Preferably not going through a broker, because again, they get their cut and then they end up paying less to that team, and then that team has to cut corners in order to make a profit. So these number of questions are designed or have been extracted from that document. Ultimately, whoever benefits from it is the patient, because you're a one-time buyer. You're not an expert at this, so we have to give you the tools to become an expert. So there's a printable list. That's a little checklist that asks those specific questions. If your doctor, physician, or provider for weight loss outside the United States cannot or will not comply with this list, don't go there. You're not safe.